so amazing to see you all here today in a press event that I think 24, 36 hours ago we didn't even know was going to happen. So I'm so proud to be here standing with my partners who sit at the coalition table with me. And I just want to say Planned Parenthood is so proud to stand with our union brothers and sisters during this entire fight. We believe that healthcare is a basic right. The Badger Care program overall is so important to the women and families of Wisconsin, and the Badger Care Family Planning Program is particularly important to the patients that we see at Planned Parenthood. We serve about 73,000 men and women in Planned Parenthood, and a large majority of those women and men are on the Badger Care Family Planning Program. Under this program, they get access to basic health services. They get access to reproductive health care cancer screenings. They get access to STD testing and treatment, birth control counseling and services, prenatal counseling and referrals to prenatal care providers. It's available to men and women in Wisconsin who don't have access to these services in the private market. It's a critical program. We've heard a lot in the media and from lawmakers the last few days about a so-called fiscal crisis and government savings. Well, if the legislators listened for a moment to what we were saying, they would understand that family planning services are one of the most cost-effective investments that the government can make. The program that I'm talking about, the Badger Care Family Planning Program, was actually implemented under Tommy Thompson in 1997, implemented in 2003, and since that time it has saved the state of Wisconsin over $700 million. In 2008, the last year that we have good numbers for, it saved the state $139 million. So the impact of the savings of this program cannot be underestimated, and we need to keep talking about, if you're really talking about savings, you need to invest in prevention in our state. I think the bottom line for Planned Parenthood and for so many of us in this room is that the hundreds of thousands of working families we've seen outside the Capitol protesting that are on Badger Care and that are on these critical problems need to start calling the bill what it is. It's an attack on our basic access to health care on so many levels. It's a fast-tracked initiative that really contains covert policy items that I think John said it best reading from the Fiscal Memo Bureau, that have no impact, no cost savings on this budget, on this biennium budget. So we need to really make sure our legislators hear the message that we're not going to let important programs like Badger Care be swept to the side, and we're going to make sure that they let the public talk about this and know what's happening. Thank you.